Okay, thank you for joining me down here, my friends, for part two. Where's my foam roller? Yes, okay, foam roller. All right, so the structures that create this pattern live right here, okay? So here's your greater trochanter, the greater trochanter of your femur, this big knob of bone right here. And then you've got your iliac crest right up here. And in a fan of musculature coming up from the greater trochanter, you've got tensor fascia lata, the muscle that tenses the milky fascia, the fascia lata, or also known as the IT band, okay? That itself is not a contractile structure. It's a strap of fascia, of connective tissue. So, anybody that tells you to roll that sucker, run the other way because they don't know what they're talking about. So you can roll, however, and get benefit from rolling the abductors of the hip, the abductors, the muscles that do this, which is the motion, or one of the motions involved in that fencing lunge that we were talking about, that will likely exacerbate a valgus knee pattern, okay? So to do this, I start with the foam roller. Whenever you're doing soft tissue work on yourself, or whenever I'm doing soft tissue work on myself, I should say, I like to start general and then get specific, okay? So start with the, broader kind of strokes and then work into specific work. I mean, this is how I do when I'm doing manual therapy on a patient as well. But I think it's good practice in general. I think I've found that the work tends to be much more effective that way and more comfortable. All right, so many of you have probably seen this one before. The thing is, I want to be just above this. I want to be just above the greater trochanter here, just above that knobby bone in your hip there. If people are having trouble locating it, just drop me a comment and I'll see if I can post a diagram. All right. So I'm gonna sink in here, and this is usually pretty